Hello, everyone. Thank you for joining us today. We're getting started with our event. I'm so grateful you can make time for today's conversation, and I'm really excited to be moderating and to kind of bring you all along in this conversation. So my name is Jane DeBovi. I'm one of the attorneys here at Tennessee Justice Center, and for the last 2 years, I've been our Equal Justice Works Fellow. This means that I've been working on health equity across our team, so I've gotten a firsthand look at why these programs matter, and I'm going to present that into the conversation today. So we're here today to talk about the enhanced premium tax credits, and we'll specifically be talking about what's at stake if families don't have access to health care that they need to thrive here in Tennessee and frankly across the country. We'll have a presentation from some of the panelists you see here today, Jonah Alfred, Nicole Wellington, and Tom Negri. We'll be talking today about these programs and then also opening the floor to a Q&A from people. These are experts in their field, and here at TJC, we know a little bit, but we're happy to turn over the mic to these folks to go into depth about the role of the enhanced premium tax credits, the marketplace, and Medicaid in the health of families here in Tennessee. So before we get into the details of today's conversation, I'm going to hand it over to Michelle Johnson to talk about what we're doing here today and to also thank you all, welcome you all formally to today's event.
Thanks, Jane, and welcome to TJC. We're super excited to finally have space where we can host a conversation like this, and many of you might know that there's a few other news stories. So getting the attention of the public and the news media about this really huge crisis coming towards Tennesseans, our neighbors, our healthcare infrastructure, and our economy is something that we are really excited to be able to do today. I'm really grateful for Joan, who was going to be in town and said, "Hey, if you need me, let me know." And so we said, absolutely. Got Nicole and Tom Negri, all of them are experts in their field, and I can't wait to hear them explain to you what is going to happen without your voice. We are excited to be live streaming this, so there will be people watching. Hopefully that can make a difference. So take it away, Jane.
Thanks, Michelle. So I'm going to start off with some panelist bio introductions just to give you all a sense of who we have here today. And then I'm going to turn it over to Joan to give a presentation about the marketplace and the marketplace's role in the healthcare system overall. And then we'll just kind of go in turn to all the folks here present today. And then we'll have a little bit of a conversation, a bit of a Q&A, questions from me as well as from you all. So as these folks are speaking, please keep your minds open, think about what they're saying, about the impacts of some of their words, some of the information that they're sharing on healthcare in Tennessee, and please ask questions. We want you all to leave today informed, excited, and ready to advocate to protect the marketplace. And so we'll to our part. So first up, we have Joan. Joan Alkert is the executive director and co-founder of the Georgetown Center for Children and Families, as well as a research professor at the Georgetown University McCourt School of Public Policy. She's a nationally recognized expert on Medicaid in the Children's Health Insurance Program, also known as CHIP, and is the lead author of CCF's annual report on children's healthcare coverage trends. She's been extensively published on a wide range of issues, including Medicaid waivers, child and family health, the role of Medicaid in rural areas, and more. She's bringing that vast expertise to today's conversation about the marketplace and what she'll explain what Tennesseans need to know to take action. We'll also hear from Nicole. Nicole is the grassroots manager for the American Cancer Society Cancer Action Network here in Tennessee. She manages all volunteer efforts as they relate to lawmakers and public policy. ACS CAN, the Cancer Action Network, works to end cancer as we know it for everyone by advocating for evidence-based policies at the state, local, and federal levels. Nicole holds a master's in public administration from Florida Atlantic University and lives with her family here in Mount Juliet, so she's local. Nicole will address the role of the marketplace in providing health care to cancer survivors and their families. We'll also hear from Tom Negri. Tom is a multi-hyphenate. He's worked in the hospitality industry for most of his life, including for 35 years with Lowe's Hotels here in Nashville, but he's also managed properties in New York, in DC, Nashville, and in Columbia. His career has given him an opportunity to collaborate with tons of nonprofits and community organizations across the city. And he currently serves as chairperson of Our Place Nashville, which provides housing for over 140 residents with developmental disabilities. He was also the founding chairperson for Nashville for All of Us, which stopped the ballot initiative that would have required city employees to speak only English. Tom has lent his leadership to groups including the Greater Nashville Hospitality Association, the Tennessee Hospitality Association, the National Hotel and Lodging Association, YWCA of Middle Tennessee, Habitat for Humanity of Middle Tennessee, the Tennessee Immigrant and Refugee Rights Coalition, the Nashville Convention and Visitors Bureau, and the Diocese of Nashville Investment Committee. We are so grateful to have you all here today with all your cumulative expertise. And with that, I'm going to kick it off to Joan. Joan, can you just get us started understanding, if folks don't already know, what's the marketplace and what are enhanced payment tax credits and how do they fit into the national conversation about healthcare today?
Sure. Well, thank you. It's great to be here. I'm pretty happy to be out of DC. I love DC, but it's a little over militarized right now, and it's not a good vibe. So let me just give us a little walk through history and think back to when the Affordable Care Act passed in 2010, and this was, maybe 100 years in the making to get to something approximating universal coverage. And the idea behind it was we're going to expand Medicaid for the lowest income people up to 138% of the poverty line. And then on top of that, to construct this marketplace, which would provide a robust source of private insurance coverage for people who were not getting covered through their employers. And that was the concept, right? And we won't diverge into the Medicaid track, which, is I'm very passionate about. But of course, as we all know, the Supreme Court, and you all know here, struck down the mandate of the Medicaid expansion. That's how we got to where we are. Now, the marketplace offers coverage that is subsidized through what are called APTCs, Advanced Premium Tax Credits. And initially, when the law passed, the tax credits were not, frankly, as robust as they needed to be affordable, particularly for people who are the lower end of the eligibility. Folks are eligible originally in the law, 138% of poverty to 400% of poverty, but in states like Tennessee that have not expanded Medicaid, that eligibility goes down to 100% of poverty. So it's just a weird quirk. So here in Tennessee, it would be folks, right above the poverty line up to 400% of the poverty line. And the marketplace was a critical piece to kind of fill that gap that existed in a world where private insurance was either too expensive or just not available to people. People got, rated out of the market, pre-existing conditions. All these things existed before we had the marketplace and the insurance reforms that came with the Affordable Care Act. So that was great, but everybody knew that, they would work a lot better if they were more heavily subsidized. And indeed, about 5 years ago, that came to pass. And under President Biden, he was very committed to making the marketplace work. The marketplace became even more robust. In fact, with these enhanced subsidies that came about, really during the pandemic, the marketplace almost doubled in size in terms of enrollees. Now, these advanced premium tax credits, the enhanced subsidies, are expiring at the end of 25, like 4 months away, right? Because we're almost in September. And as we all know, Congress just went through an exercise of passing HR 1, the Budget Reconciliation Bill, the big, beautiful bill act, so-called, which cut Medicaid and the marketplace, primarily Medicaid, to the tune of $1 trillion. And the Congressional Budget Office estimates that about 10 million more people will become uninsured. Most of that relates to Medicaid cuts, but some also to cuts to the marketplace and deregulating and making it harder, more red tape to enroll in the marketplace, shorter enrollment, things like that. And what Congress didn't do in that bill was to extend these subsidies. So we are now in a situation where Congress has very little time to act. The insurers have already had to submit their products for pricing, and it is estimated that the premiums will go up about 20% if the subsidies are not extended. Now, is Congress going to extend the subsidies, right? It's a theoretical possibility. Let's just review where is Congress right now, okay? In fact, and in terms of what they're working on. So Congress is out of session right now. As you know, they passed the budget bill that was signed into law on July 4th. And typically they take a long August recess. They recessed a little bit early because of the Epstein. Folks may remember this. There was a lot of pressure on the floor, and so the speaker just released the members. So they couldn't do any more business. So they're coming back soon. They'll be coming back after Labor Day. They have to do all of the appropriations bills, right? So the fiscal year for the federal government runs out September 30th. So they've got to get all of those bills passed. There's none of those bills are signed into law. Usually they end up being a big omnibus bill. You know, we get into the situation of a government shutdown, or we have an extender bill, right? And so that's probably what's going to happen again this year. So there will be a must-pass piece of legislation. Theoretically, Congress could extend the subsidies on that bill, but it's not cheap. And I'm forgetting the exact score, but it's in the range, I believe, of $300 to $400 billion. So no one is really holding their breath. So again, it's not out of the realm of possibility, but it seems very, very unlikely. And unfortunately, the insurers have already had to price in the assumption that there will not be the enhanced subsidies. So that's where they are. I think, you know, I don't know if this is going to perhaps cause a little more interest in expanding the subsidies, but when you look at where's the growth been in the marketplace in the last few years, it's really been in the non-expansion states. That's where a lot of the growth has been driven in terms of marketplace enrollment. So there are a lot of red states that are going to suffer if these enhanced subsidies expire. So that's where we are. I'll just mention before I left, KFF, I'm sure a lot of y'all are familiar with, used to be called Kaiser Family Foundation, now they're called KFF. Great source of information. They just did a report that estimated coverage losses by state due to a combination of the passage of HR 1 and all the Medicaid cuts. We'll talk about them in the Q&A if we want. And the expiration of the subsidies. So for Tennessee, KFF estimated that there would be 210,000 more uninsured, 210,000 more uninsured people, and most of that is due to the expiration of the subsidies. 180,000 of those people are due to the expiration of the subsidies. Because a lot of the Medicaid cuts, a lot of the Medicaid coverage losses are due to the new work requirements, which won't affect a state like Tennessee because you don't have expansion. So it's in part due to some of these repeals of Biden era simplifications, regulation of the marketplace, but it is primarily driven by the expiration of these subsidies. 180,000 people here in Tennessee. So this is fast upon us. The clock is ticking. We can feel the weather outside. You know, summer is waning. And I think I'll stop there and
Yeah, that's a really helpful lay of the land. And so just to contextualize some of what John shared, by the last report in November of 2024, there were about 625,000 people enrolled in Tennessee's marketplace, and around 200,000 people stand to lose coverage upon expiration of these tax credits. So we're talking about a third of the folks who get their healthcare from the marketplace are at risk of losing essentially their only path to coverage. So just in terms of numbers, the gravity of the situation, that's what we're talking about. We can put that 200,000 number in context here in Tennessee. But I want to talk a little bit more about the marketplace. So folks might be familiar with Medicaid because they know maybe the general eligibility requirements that you have to meet to use the program. And then folks might be familiar with the typical private employer-provided health insurance. What is the typical person who ends up relying on the marketplace look like, and how has your research kind of uncovered the critical role of marketplace coverage for that population?
I know Nicole's gonna be able to speak to this too. I will say, first of all, we have a sister center at Georgetown called the Center for Health Insurance Reforms, and they do really good stuff on the marketplace if you're interested. The marketplace enrollees tend to be more likely to be adults than children. That's one thing to know, because children are eligible for Medicaid at higher income ranges. So there's, I think, about 1.7 million children in the marketplace nationwide. So that's in overall 20 million plus. So it's primarily adults. It is mostly people who are working in self-employed or small business, or they're working in the gig economy. So they're not able to access health insurance through their jobs. That's primarily who we're talking about. Another factor that we've looked at with respect to Medicaid, but I think the same is very true for the marketplace, is that rural communities have higher rates of enrollment both in Medicaid and subsidized coverage because their incomes tend to be lower than urban areas. So that's very characteristic.
That's really helpful. And talking a little bit more about rural areas, and I guess just generally low income areas, what can you paint a picture of what happens when folks use this, get this health insurance coverage, especially in rural areas where there are overlapping issues like lower health outcomes as a result of hospital closures, as a result of lower access to providers? I guess, how can we think of these overlapping issues in the face of the expiration of the credits?
Yeah, so I think, for everybody, but rural communities especially, this is like a rolling set of problems. It's like a wave that's growing, and it's gonna crest down the road. So the immediate issue is the expiration of the tax credits. And of course, as we all know, if people are uninsured, they just can't afford healthcare, unless they're very rich, and it's a huge economic burden for people. Down the road, as the Medicaid cuts kick in, this is a very big threat for rural communities. We have not only a lot of rural hospitals threat, but one issue that we've looked at very closely is the loss of labor and delivery units in rural areas. And in fact, now the majority of rural hospitals, just over 50%, have no labor and delivery capacity already. So for rural communities, if there's not a safe place to have a baby, it doesn't matter what your insurance is. You can have great private insurance, but if you can't deliver safely, your community is just not going to thrive. And so, the Medicaid cuts are more back-ended. There are very serious changes and limitations on the way states are able to raise their Medicaid share through provider taxes. A lot of these issues are going to affect rural hospitals. There is a new fund. We can talk about that later in the Q&A if people want, but it's not going to in any way be able to make up for the Medicaid cuts, particularly as they roll out. They're going to get worse over time. So this is just going to be a crescendo of challenges for rural communities and rural hospitals who already are suffering from provider shortages, and especially acute, again.
That isn't me. No.
Maternal health issue.
Yeah. Well, that's really critical. So before we move on, let's go into some of the more technical parts of the conversation. You mentioned the congressional landscape, and you also talked about how the insurers have already calculated their premiums for next year. But we understand that there's a battleground right now in Congress. There is, however, potentially small, there is room for advocacy to for negotiation to find money essentially for these enhanced premium tax credits. What do you know about that conversation, and how can we kind of take what looks like a sliver and turn it into more of a campaign at this level?
Yeah, I mean, I just, we're so overwhelmed by this like tsunami of news and crises and, you know, National Guard marching in and here and there and everywhere. So I just think this issue's getting lost, and we really need to refocus the conversation on the basics. Like people's healthcare costs are gonna go up January 1st if they don't do anything. You know, that's what I think the struggle is, that there's really been a loss of focus on with this sort of crisis, you know, drama world we're living in, to like refocus attention on people's needs. So that's what I think all of you can play a really critical role in doing, is just like, hello, representatives, we would like you to focus on something that matters to families and communities in our state. I would just make one PS to please say, do not enhance the subsidies or maintain them by cutting Medicaid. Because I'm a little worried that might come up.
Where will they find the money, essentially? So that's really helpful, thank you. So just for folks who are newer to the conversation or wanna hit on the highlights, the bill that we're talking about passed July 4th. Congress is in recess for the rest of the month. It's late August and they reconvene after Labor Day. So we're at a really critical point to have the types of conversations that Joan is talking about amongst ourselves and elevate them to the national level. So before we move on, I just wanted to re-highlight the timeline. We talked about a lot of technicals here, but the goal is families need protection, families need healthcare, and that's why we're here today. So that was really helpful to get us started, Joan. Nicole, I'm gonna turn it over to you to talk a little bit about specifically cancer survivors and families affected by cancer in the marketplace, and just leave it to you to kind of give folks that perspective, which is really critical.
Sure. Thank you for having me here, first of all. So I'm Nicole. My role is as a grassroots manager for the American Cancer Society Cancer Action Network. So we are the nonpartisan advocacy affiliate of the American Cancer Society, who I'm sure you've heard of. So we're the 501c4 side that works on advocacy. And my role as a grassroots manager is to work with cancer patients, their families, cancer survivors, researchers, advocates in general, and elevate their voices and their real lived experiences to lawmakers, to really put a human face with the policy, and to advocate for evidence-based policy that reduces the cancer burden for everyone. So extending these tax credits is a huge policy priority for us, and we're working, we have a federal team that is working with Congress and is in these conversations, and then we at the grassroots level are working on talking to survivors and talking to patients about the real life impacts. So these tax credits have been absolutely critical for cancer patients to maintain access to treatment, for survivors to maintain access to follow-up care and prevention of recurrence, and to maintain access to cancer screening, which everybody needs. So since the Affordable Care Act was passed, the plans have been available, and that was a huge win for cancer patients. Prior to the ACA, cancer could be used as a pre-existing condition and to deny people follow-up care because they were cancer survivors. So more than 24 million people enrolled in marketplace coverage in 2025. We don't know the number of those that are cancer patients. We don't have that information, but we know all of them need access to cancer screening. And some of them are cancer survivors, some of them are cancer patients, or their parents are cancer patients, or either way though, everyone needs access to screening to reduce cancer rates. And more than 90% of those marketplace enrollees relied on these tax credits to make coverage affordable. You probably know that cancer is a massive financial burden on patients and their families. So these tax credits are that financial relief and sometimes the difference between life and death. In Tennessee, our cancer burden is already incredibly high. We estimate that over 42,000 people will be diagnosed with cancer this year in Tennessee, and almost 15,000 Tennesseans will die from cancer this year. We have higher rates of cancer incidences. We have lower survival rates than national averages. We have a ton of health disparities. I'm glad that Joan was touching on the rural health issue because, you know, we are a state with a huge rural population and we see massive cancer disparities in those populations, and they face unique barriers to cancer care in themselves. And then, as she said, rely more heavily on the marketplace than people in cities with access to cancer centers. So we also have the highest rate of rural hospital closures per capita in Tennessee. So it's increasing crisis situation we have here in Tennessee that we really can't afford to have get any worse. And what we see like in research abundantly is that uninsured Americans are much less likely to maintain their regular cancer screening. And when they're missing screening as recommended, then their cancer is getting diagnosed at a later stage. And so treatment's harder, more expensive, and survival's less likely. And then the big thing about the marketplace and this kind of insurance coverage in cancer patients is a lot of them are facing unique challenges to employment. A lot of them can't maintain full-time work during treatment. Treatment is like a full-time job in itself. Sometimes they're having daily treatments. Sometimes they're having, while coping with the side effects, they're not able to return back to work. Some of them aren't able to return to work ever because of compromised immune systems, and where they're left with permanent disabilities as a result of cancer itself or the cancer treatment. So when insurance is just inextricably linked to full-time employment, it creates these barriers for cancer patients to even have access to health insurance. And the costs of cancer are just already so crushing to patients and their families. Nearly half of patient cancer survivors nationwide report that they have medical debt related to their care. The majority of that debt has already been sent into collection, so it's affecting their credit, it's affecting their economic well-being as a whole. We did a survey last year of cancer survivors and found they reported that survivors who have medical debt are 3 times more likely to get behind on their follow-up screenings. So it's really linked to their lower rates of survival when they lack this access to insurance. And so, as she was saying, like if they fail to extend these tax credits, premiums are projected to rise by 20%. But a lot of these, like the KFF that she was talking about, can see in many cases it can increase by 100%, by 200%. So for working families with cancer patients in their families, that's going to put them in a position where they're having to make these impossible choices of like, do I pay rent? Do I pay groceries? Or do I pay for my cancer care? In a real life kind of how that looks in real life, like last week I met with a patient. She's currently undergoing treatment here in Nashville. She's from a rural area, so she's hasn't traveled 2 hours to get to treatment in Nashville. She's now able to stay in Nashville. But she had just started a new job as a nurse. So she didn't have paid leave, and her employment wasn't protected by FMLA because she hadn't been here for a year. So she's losing her job, and as a result, she's losing her health insurance. And she was just talking to me just in tears about the mental health burden that she's now facing with, while already facing stage 3 cancer, that now she's just worried, like, am I going to be able to survive? Like, am I going to be able to pay for myself to be able to survive? And so marketplace plans, with these tax credits, making them affordable, then provide this viable option for patients exactly in her situation, where treatment's making it impossible for her to maintain full-time employment. Maybe she could do some contract part-time work. There's no way she can have a full-time job with health coverage right now. And so without these tax credits, patients like her just lose any viable option that they have for care. And it's also estimated that of the people losing coverage, of the people at risk of losing coverage, that includes 1 in 4 people with chronic health conditions like cancer are going to be at risk of losing coverage. So we, as ACS Can, again, we're having these conversations at the congressional level and the grassroots level. We're just urging people to write to your members. Senator Blackburn's going to be really instrumental in that decision-making process. She has a lot of power in that area, and it's just it's as constituents, say this, that we want our youths to have healthcare coverage. Yeah, it's just, the time is now. They can't wait. Cancer doesn't wait. Cancer doesn't check on whether somebody has access to insurance. Cancer remains there. Cancer can't wait for Congress. So we need this now. We need Congress to act now.
Thank you. That was a really, really helpful deep dive. I just wanted to give you a chance to talk about when we think of the rapid increase in the number of people who have enrolled in the marketplace because of these credits. Can you talk a little bit about how your coverage changed in the last year or so with this reliance on the enhanced tax credits, what it looks like you're talking about if they're to be taken away?
I think unfortunately, like a lot of people aren't even aware as much of what is at stake right now. Even people who are on marketplace coverage aren't always aware of that. I think, we obviously we're sit in this world and we talk about healthcare policy all day long. But for your average person or someone who's just got diagnosed with cancer, that hasn't been on their radar. And then all of a sudden they're in this position where they're in this situation where they no longer have access. And so I think a lot of the conversations have been about the need for educating people, just awareness on how absolutely vital these marketplace plans are, how important the provisions of the ACA were. I think people sometimes forget about how it was when pre-existing conditions could be a discriminating factor in your access to healthcare. So yeah, it's been a lot about just education and awareness.
Yeah. And the shock factor of this was to be
right.
Like, they're not ready for
that
change. That's great. So again, we'll have more time for Q&A and more conversation, but I'm going to turn it over to you, Tom, to talk a little bit about the local business community, the gig economy that we've heard a little bit about, and that perspective. So please share.
I have one question for everybody that's up here. Is there a bill currently written, or do we have anything that's going to? Do we have anybody sponsoring anything? Not quite yet.
There's a negotiation happening. There's no text that we can necessarily point to at this time.
Right. So I'm Tom Negri. Hi, it's great to be here. Talk to you a little bit about those in the hospitality industry, those in the construction industry, those in healthcare, especially home healthcare, and they're the people we're really talking about. It's interesting being in the hospitality business for over 35 years with Lowe's Hotels. We all had health insurance, and we had dental insurance, and we had eye care, and all of that sort of stuff. And I think back in 2005, we even started partner benefits, which dropped our turnover rate by 11%. I mean, a simple act like that and saved us a lot of money, but people aren't looking towards the future the way they should with this. And I say that because when I looked at the figures of those who are not covered by insurance, it's around 9.3% of those in Tennessee that are not covered by insurance. When you break it down further, our Black population, 11.6% don't have it. Latinos are about 30%, 29.4%. All right, and that is due to the fact that they're just not counted. We're just not counting certain populations the way we should be counting certain populations. The Asian community is about 8.3 and the white community is about 8.9. Now, if you look at who needs these subsidies, it's very, everybody needs these subsidies, no matter what county you're living in. But if you look at, say, Williamson County compared to Knox County, it's really sad. I mean, Williamson County, just over 5% that don't have health insurance. But you look at some of the other counties, it's pushing 20%, 26%. All right, and it's only getting worse as hospitals close. And if you speak to the hospital operators here, which is kind of interesting, and see who's birthing babies, right? They're birthing babies from all over Tennessee. And that's a good thing because they can't get it done in their communities. As I believe, Joan, you mentioned that they're just 50% of the hospitals are no longer providing that service. Isn't that scary? And that's before this. So my big question coming into this, because I'm sort of a rowdy guy, is what can we do to make sure that we can move the needle? We all watch our news outlets or see it online or social media or whatever we're doing, and that's certainly what you can do. Write a letter, right, to the news media, whether it be Channel 2, 4, 5, Fox, it doesn't matter. Saying, are you aware this is gonna be happening? And are you aware that in our state, we have currently about 644,000 people without healthcare insurance, all right? This will push it by 200,000, all right? Or about a 35% increase of people without health insurance. What's that going to do to your insurance premiums in the future? What's it gonna do for their health? And what's it gonna do? And we need to pose these questions, both online and social media and to the networks, because they're just missing the bigger point. I don't know about you, but I'm a little tired of hearing about Epstein. You know what I mean? I tell you what should be done with that, but I don't want to bore you. What we need to do is attack hard, resist this change, because no one's talking about it. And if no one's talking about it, we're not gonna get this fixed. All right. So with that, I think a lot of people think about how many people were aware of this issue before coming here today? Raise your hands. Well, most of you, and that's really good. Well, maybe not most of you, maybe half of you. All right. But imagine what it is outside. All right. I wasn't as aware of this issue as I should have been. So I think it's really important in that case. I also think it's important that you speak to your rabbi, your priest, your clergy member and say, do you realize this is going to affect us? All right, and this is why, and they need to talk about it. This is not a political issue. This is a moral imperative. All right, and we need to phrase it as a moral imperative. A lot of things today are wrapped up in politics. All right, which in my opinion shouldn't be wrapped up in politics because it becomes a moral imperative. All right, there needs to be a separation of state, obviously, and religion. But when that line is here, when people are losing healthcare and dying of cancer because they can't afford it, oh my God, we can't be sitting on our hands. We need to get out there, we need to talk about it, and we need to address it. Sorry.
No, thank you for getting us started. I do have some more specific questions for you. You have been in a position of managing folks in the hospitality space. You talked a little bit about that. Can you give folks who might not be aware a perspective of what stable and unstable employment looks like? And extending, going further into that, what it looks like if someone doesn't have healthcare. If you're sicker, what does that look like when you show up at work? Can you show up at work? And just painting the, really, I think, making clear the connection between the marketplace and employment and the folks who unfortunately don't have stable employment. Do you have a perspective on that based on just like what you shared? Right, I was hoping you could just give folks that information so that they're aware that that's really what we're talking about here.
Having been the president of the Hospitality Association, both in Tennessee and here, it's a large gambit. All right, at Lowe's hotels, it was great. Our employees got one meal a day, and it was usually their biggest meal of the day. All right, and they had insurance and things similar, but that's not how it happens in the hospitality industry. All right, we were Lowe's, the Vanderbilt Hotel Corporation. We were able to make our decisions locally and manage our business. But there are a lot of other hospitality organizations that don't operate that way. All right, so they go to work, they have to buy lunch, they have to bring lunch. All right, and they don't have insurance. All right. And what's happening in the hospitality industry today is generally not a good thing. They're contracting out housekeepers because it's more reasonable. All right, they don't have to pay healthcare. All right, when you go to your favorite restaurants, I'm sure you will go to your favorite restaurants. All right, I bet, do you have health insurance doesn't ever come up. All right, but if you're going to a small restaurant, I guarantee you, it's not there. All right, and it's a problem, and it's a problem for them, and it's a problem for us. All right, down the road a piece, because we should be concerned. And again, going back to the moral issue, home health care is another scenario. With a, my sister was a nurse for 30 some odd years in Florida, of all places, and.
Florida.
Oh, there you go. No, sorry. She worked for 4 hospital companies, all right, and she ended up having to get a need of a liver transplant, and they all declined her as a nurse, and she passed away 5 years ago without having the surgery, even though her sisters tried to pay for it. So I think it's incredibly important, this issue. Because it's going to affect each and every one of us as we look back on this. So make friends with your server. Find out what they're doing. Find out how they're doing. It's tough out there. They may be making more money per hour because no one can find help in Nashville. All right. But the odds are they don't have health insurance. Even based on that 50 per employee.
So thank you. I think that's a good place to pause and kind of move more into the conversation. But Tom has just provided us a very clear look at how this issue impacts us, even if we don't know the technical parts, even if we hadn't heard about enhanced premium tax credits until maybe the last couple of weeks. It's the people that deliver your food on Uber Eats, because the gig economy is so critical here in Nashville. The cost of living crisis is what has pushed people to rely on whatever employment they can get. And when you don't have full-time employment, again, the tax sure. And so hopefully that kind of brings it to everyone. We've gotten the high level technical perspective, the role of the Cancer Society in advocating for, the Cancer Action Network in advocating for this issue, and the business side. So this is something that you can really understand from a multitude of perspectives. So before we jump into further conversation, I just want to thank you all for giving us that expertise and getting us started. I hope folks here are more caught up on this issue than they were 45 minutes ago. And I'm going to turn it over to the crowd for some questions, and hopefully hear from them what they think about this issue and anything else you all can expand on. Do folks have any thoughts on what they've learned today, or any questions that they would like to pose to our speakers, or to maybe even the audience? I don't know.
I just want to ask anybody on that, how do you talk to people who have health insurance through their employer and say they don't care? They have health insurance, so they don't care. Aren't these going to affect their premiums with their, is that one way that you can, they don't care about the other guy because they have health.
Well, it's going to affect their premiums. There's no doubt in my mind.
So we can say that with.
Oh, with absolute certainty. Every year I can remember, gosh, can I remember, the double-digit hike that I would have to tell my staff members that they may be responsible for. All right, and it was heartbreaking. All right, so if they may get it from their employer, and there's some employers here in Nashville, which I'm familiar with, that pay it all, and that's really great. All right, if they pay it all and they're getting double-digit hikes in health insurance, all right, watch what the annual raises are going to be a bit lower to cover the cost of the health insurance. So it's all the same basket. It's a matter of what percentage of profit that corporation is going to need at the end of the year.
Do you have any numbers for that?
I think we can, we have the rough estimated premiums that the insurers have calculated that will kick in January first, like Joan was kind of mentioning. I don't have those off the top of my head, but those numbers are out there and they have calculated them, like Joan said, assuming that there is no enhancement of these tax credits. So the numbers that we're seeing are for folks in the marketplace, but they're also a picture of the insurance companies as a whole. So there's that information out there, but it's all kind of in flux because we don't know yet what's gonna happen. Anyone else have thoughts on the relationship?
I just want to
Yeah.
also touch on the rural hospital closures that we keep talking about. The less people having access to healthcare means hospitals are not getting paid because hospitals still have to treat people whether they have insurance or not. So these hospitals are defaulting and essentially being bankrupted by a lack of insurance coverage. And it's, again, Tennessee has the highest per capita rate of hospital closures. And I feel like that's another thing we just aren't talking enough about. Like, this is a huge crisis. And it's also not just limited to rural hospitals. If then the rural population is using our metro, the urban hospitals. I cover Alabama as well, and we in Montgomery, a hospital, half of their hospital beds are at risk of being lost right now, because their hospital has defaulted because of essentially lack of income. So I mean, there will be a point where people not having access to healthcare will mean you don't have access to healthcare systems in your own place.
That's great.
And Sarah Sullivan, retired nurse and volunteer with the Tennessee Healthcare Campaign. And we started out back in 2010, organizing volunteers with TJC and others across the state to help people enroll. Now we have a nonprofit insurance agency, a couple of agents, work in rural areas. But so we've been, worried about this happening, from day one when it's, clear that, the expiration was going to be the end of this year. And there was one period during the negotiations, where there seemed to be some hope because there's so many rural representatives and others who are in the same, whose constituents are in the same boat as we are in Tennessee, although I think, Tennessee might be a little extreme with 90% or so of people needing subsidies to their plans. But do you get a sense, and I guess I'm directing this at Joan because you are in DC, that there's a constituency that could be moved, to reinstate the subsidies enhancements before the end of the year? Or
Yeah, it's interesting. I mean, first of all, I agree with your observation that there really was, in the Medicaid fight, there was a lot of concern about rural hospitals, rural communities, and that's why I think in order to squeak it through, right, because it passed by one vote, they added this Rural Health Transformation Fund, which is $50 billion over 5 years. So it's actually not for rural hospitals, contrary to popular belief. And I think contrary to the belief of some of the members, they slammed this thing onto the floor, we're reading text like right up to when they brought it on the floor. And it's actually literally not money for operating costs of rural hospitals. It's quite explicit in the legislative language. Yeah. So, and it's front loaded. There's 25 billion is to be distributed across all states, and there's sort of 25 billion that Secretary Oz is going to have a lot more discretion over. And I call it Secretary Oz's walking around money. Okay, I mean they're going to try to get this money out the door quick, get some nice like photo op things for the midterms. I'd hate to be super cynical, but they're running that money out quick. And the cuts on Medicaid are really back-ended, that they'll get worse and worse over the 10-year period that the bill estimates relate to, but this money is front loaded, right? And so, and again, it's not for operating costs for hospitals. It's supposed to be for, transformative projects. So it's hard to be transformative if you don't have, the basics. So I do think there really is a lot of pressure, and that was clearly that fund went up from 25 billion to 50 billion, like right in the last couple days to get the votes. But whether that rolls over to this issue, not sure. Now, when the bill went through the House, HR 1, it did go through committee, unlike the Senate where it went right to the floor. And the House Ways and Means Committee has jurisdiction over the tax credits, and the Democrats did offer an amendment to extend the subsidies, and it was voted down on a party line vote. So the Republicans did have a chance to extend the subsidies, and they didn't. But again, there is obviously going to be a vehicle movement to keep it going. So never say never. And I think, again, it's really the red states that are going to feel this very, very hard, especially, Florida, Georgia, Texas are really going to get whelmed by this. But I don't know. I mean, politics as it used to be practiced for many years. It's not really what's happening right now in DC.
If I could make mention, TJC's wonderful, they have a data page. And if you look at this data page, and if you look at those counties, the rural counties that certainly need what we're talking about today, all right, it would be important that we not only speak, right, or put on social media, but call out your state representatives and say, look, you need to put some pressure on our Congress people and our US senators, all right, and even our governor, because look what's happening in Van Buren County, all right? I don't even know if they have a hospital, but neither here nor there, their healthcare costs are going up, all right? And it's just horrible if you look at this map and, you look at, I mentioned Williamson County earlier. Williamson County is the 8th wealthiest county in the United States of over 3,400 counties, all right? Yeah, they're not too concerned, although there were poor people in Williamson County, believe it or not, all right? We need this to happen. Oh, there it is. Isn't that beautiful? Thank you for doing that.
Thank you for that. So for folks who want some information, we can, you can go to the TJC website for this. And if it just gives you some background, if you're pushing this conversation with your colleagues, with your family, with folks in politics. So just get informed and contextualize some of this conversation, and whether your focus is maternal health or cancer or other chronic illnesses. Of course, we have a bunch of questions. So, or can I go to? Yeah, go ahead.
Of the 210,000 more uninsured, do you have a feeling for how many of those will be persons with disabilities?
I don't have that particular number of folks with disabilities, but I think I would rely really heavily on some of the information Nicole shared about the percentage of folks on the marketplace that have chronic illnesses, and kind of use that as a good landing off point if you want to make that, if you want to have that be the focal point of your conversation.
Say the general percentage of TennCare overall would apply more or less across the board or not?
Sure. Can anyone else? I wouldn't say. I don't think we can specifically say that.
As mentioned earlier, I chair Our Place Nashville. We provide housing for the developmentally disabled. We have a waiting list. We cut it off last year because it was too high. We still have a waiting list of 85. All right, and we're going to open the waiting list up, and that's going to go up to no kidding, about 150. All right, and we have some good opportunities for the future. But we had a family meeting of those on the waiting list, and let me tell you, everybody is concerned about this. All right, and how it will affect their developmentally disabled child or their families. So it's just not out there yet. You know what I mean? And they're all worried because they're dealing with this on a day-to-day basis. So I wish I had the answer, but it is a concern.
Well, yeah, just to Jack's question, I think if you're talking about the Medicaid population, the attrition in the Medicaid population will be random because it will be done through paperwork and the difficulty of obtaining and maintaining coverage, which means that it'll be felt across the spectrum of all the different categories that are covered, from children to the elderly. And it will have a disparate impact on people with disabilities because they are less capable of completing the paperwork and putting up with an hour and a half on hold to a call center, or resubmitting the paperwork multiple times to have it lost. All the ways that we documented in the AMC class action lawsuit accounted for the attrition of over 400,000 people during the COVID unwinding. So if you are achieving the savings by putting people through a ringer, making them run a gauntlet, you will inevitably disproportionately affect those who lack the capacity to just tolerate and navigate that sort of thing. My question was going to be to really follow up on Tom's question about, is there a legislative vehicle? There's not a bill out there now, but to clarify, am I right, Joan, that the continuing resolution that will keep the government funded could carry an amendment that would extend the premium tax credit?
That's right. I mean, I would expect this to, if it does happen, I would expect it to happen on whatever omnibus bill they're gonna move to a short-term continuing resolution, but eventually they'll have a bill to keep the government open and do all the appropriations. So that, I think, is the vehicle for this, because, that's kind of where we're at in DC. Big budget bills that actually go anywhere. But there clearly is gonna be a moving vehicle.
So we are way over time, and I want to be, I'm so grateful for everyone who was here, and thank you for being willing to stick with us past 5. We have Joan here, Nicole, and Tom. I'd love to, if we could just give them a round of applause. Information sharing and just bringing us all up to speed. I hope you all leave here today a little bit more informed about what we came here to talk about, which are enhanced premium tax credits and the opportunity for progress, which is to extend them past December of this year. And so I'm available, as are my colleagues here at TJC, to talk to you all about what you might have heard today. And I'm really excited for, I guess, what we can do together on this issue. So thank you all for being here, and I'm available for questions and for more conversation. Thanks to all.